Dr. T here, and tonight we're going to be talking about future fertility. Particularly, we're going to be talking to the topic of egg freezing. So I might wait till there's a few more on. You have got me on a chilly Wednesday evening in Perth. Hello, welcome. I hope everyone is really good. I'm in my casuals tonight, guys. I hope you don't mind. I'm sure you guys are in your casuals. If you are, let me know. I reckon this is one of my oldest jumpers. It's certainly one of my most favourite, most comfortable jumpers. Anyone else out there got their favourite comfortable jumper? I hope so. I hope you've got it on. Winter is definitely coming here in Perth, and it's all about comfort for me tonight. Anyone else feeling the same? Show me some love. I hope you're not in your finery, because I certainly am not. You've got the same glasses. So cool. These are face-to-face glasses. I'm loving these glasses. All right, so we are going to, I agree. Comfy, definitely. You're in your PJs. Oh, loving it. No, I don't quite think I could do my PJs on Insta, but anyway. Tonight we are going to be talking about fertility preservation, future fertility, and I've had surprisingly not as many questions as I expected. I actually expected loads of questions for this topic. So if you know of someone who is thinking about preserving their fertility for their future, make sure that you remember this live so you can share this, because I get women, probably more women than men, but I get people coming to me every single clinic wanting to talk about fertility preservation for their future. So because of that, I thought it would be a really popular topic, or maybe the same question was just asked lots and lots and lots. So that's what I'm hoping. But let me tell you that once again, as with all of my Q&A sessions, the information I'm going to share tonight is very general. So if you have a particular question that pertains to your clinical situation, your current life situation, make sure that you go and speak to your fertility doctor, your GP, your endocrinologist, whomever, if you have questions specifically to yourself. But we're going to talk particularly, the questions tonight really were all about egg freezing. So that's what I'm going to talk to tonight. There was one question about unexplained infertility, but all the other questions were talking about fertility preservation, eggs and sperm. So if you know someone, tag them, let's get them in here, let's talk about it. Let's get it out in the open, because I've got to be honest with you. I'm not a young woman anymore. I wish I was. But if I had been asked at the tender age of 31, 32, 33, 34, 35, have you thought about preserving your fertility for the future? I probably would have said no. And in a way, I kind of wish that someone older, wiser than myself had grabbed me as a young career woman, as a young career doctor, and said, have you thought about your fertility future? Because I might have done things differently. Just saying, I love my life. I have an amazing husband and two beautiful girls, but I might have thought a little bit more about my own fertility future if someone had actually flagged it to me. So I think this is really important information, and I think we should own this. I think it should be okay to share this stuff. I think it should be an okay topic for us to talk to people about, is fertility preservation. So the very first question, and the most obvious question from a female perspective, is when is the best time for us to think about freezing eggs? Now, the right terminology for this is oocyte egg cryopreservation freezing. So just saying, the right terminology is oocyte cryopreservation, but for ease and conversation, we're going to call it egg freezing tonight. So here's the amazing thing about women. We were born with the set number of eggs that we were ever going to have in our life. In fact, by around about 20 weeks of pregnancy, all of our eggs had been put into our ovaries. And that was it. That was all we're going to have. And we probably started off with somewhere around 5 million eggs in our ovaries. And by the time that we were born, we probably only had about 3 million left. So we started with 5 million. By the time we're born, we probably only got about 3 million left. By the time we actually start having periods, about the average age of 12, we've probably only got about 300,000 eggs left. So every egg has its own internal programmed cell death. And if we don't ovulate it off every month, it will die. And that's basically it. We have on average 500 menstrual cycles our entire life, depending on whether we're pregnant or on the pill or whatever. And so the average age of menopause when we've run out of eggs is about the age of 51. That's the average age. So what happened to all those other millions of eggs? Well, they just have this programmed cell death. And every month we're producing a group of eggs. We ovulate one of those eggs off and the rest in that group just die. So we're not a particularly conservative species when it comes to all of these precious eggs. So as we get older, we have this reduction in number. We have a reduction in the quantity of eggs. But not only that, we also actually have a reduction in the quality of our eggs. Because they've been in suspension in our ovaries at a certain level of development for years and decades on end, eventually these eggs will get to the point where they're ovulated, they're recruited into an ovulatory cycle. But the internal mechanisms, because they've been in suspension for such a long period of time, if they start to get ovulated out at, late 30s, early 40s, the internal mechanisms of that egg doesn't work very well anymore. And so sometimes the quality is therefore compromised as we get older. And that's one of the reasons why we have an increased rate of miscarriages, because the embryos created out of those eggs are not normal. They're not chromosomally normal. So we've got this increased rate of pregnancy loss due to poorer quality of our eggs. So we're challenged as women. We're challenged by quantity and we're challenged by quality. So we've looked at large populations of people and their pregnancy rates and fertility rates with time. And these large populations don't take any contraception. And what we know to be true is that from the early 30s, the pregnancy rates start to decline. The decline kind of increases from about 35. And then from 37, it's a drop off the precipice, such that every year after that, the pregnancy rates halve and the miscarriage rates exponentially climb. Now, if you think about it, 35, 36, 37, that's when most of us are just kind of, we've wrapped up our careers, we might be a few years into marriage, we might have had some good honeymoon years, traveled the world, done all those things we wanted to do as a young person or a young couple, and now we're ready to have babies. Well, that's when things are starting to drop off the precipice. So as a result of that, many people think a little earlier about fertility preservation for our future fertility. And so the question is, when as a woman should we really be thinking about egg freezing? Why is egg freezing even a thing? Well, it was about 20 years ago that the Italians actually realized that if you took an egg, so you stimulated a woman, got her egg out, and you froze it and then thawed it out, it would behave as if it had been collected fresh. So it would fertilize the same, it would implant, the embryo would implant the same, and the pregnancy rates would be the same. So this concept of egg freezing actually became a real thing that we can do. And egg freezing is considered a very standard practice now. But not only did they realize that the technique, vitrification of freezing and then thawing out, was a really good thing, they also realized that you could freeze it and then several years later you could thaw it out. And not only would it be as viable as if it were frozen, but it would behave with the same integrity as if it were that frozen egg several years before. So if you froze your eggs at 32 but thawed them out at 37, the pregnancy rates would be consistent with a 32-year-old, not a 37-year-old. Amazing. So all of a sudden, we have a technique where we could preserve our fertility in time and utilize those eggs later, but our chances of conceiving were as if we were that much younger woman, because the age of the uterus doesn't really matter. That's why much older women in their 40s, for example, can use a donor egg from a much younger woman, and her pregnancies will be equivalent to that much younger woman, not to the age of her uterus. So this is amazing. All of a sudden, we have this technique that allows women to have this reproductive autonomy. It allows them to have this choice. So when is the best time that a woman should be considering this? Well, we actually don't have any Australian data on this at all. All the data is from overseas, and it's on quite a varied group of women. It's women who've frozen their eggs for cancer because they're going through chemo. It's women who've frozen their eggs because they've got bad endometriosis and they have to have surgery. It's women who have frozen their eggs for elective purposes. It's women who have frozen their eggs because they're acting as donors for other women. So it's quite a mixed bunch. But what they've actually found is that in that group, the younger the better, but down to a certain point. So really from a cost usage point of view, if I freeze my eggs and I'm likely to use them again, but also from a benefit as far as youth point of view, I would probably suggest, well, from a cost usage point of view, somewhere around 34 to 36 is an ideal time. Of course, the younger that you are, the better the quality, but there comes a point in time where you think, am I actually likely to use this? If I freeze my eggs at 30, am I really likely to use them? Well, probably not. Probably you're going to actually meet Mr. Wonderful at some point in time, maybe have sexual intercourse, and actually fall spontaneously pregnant. Or if there is something else that impacts on fertility, you're probably just going to move forward with IVF or some other form of assisted reproduction, depending on what's actually going on. So the chances of a 30-year-old actually using her eggs is probably much lower than a 34-year-old actually using her frozen eggs. So from a cost usage point of view, 34 to 36 seems to be the approximate age. Now, of course, that's all dealing with women who have a normal egg reserve. But women who are younger, who have a lower egg reserve, it would be reasonable to consider freezing earlier rather than later. So is there an ideal age? Well, depends on what your parameter is. If timing in your life is such that you're having a fairly low social time right now, and the concept of going through an egg freezing cycle is challenging, then it might be that you would want to freeze a little earlier, perhaps 32, 33. But really, if we're talking from a cost usage perspective, I guess a pros and cons perspective, probably 34 to 36 is about the sweet spot if you've got a normal ovarian reserve. How does the egg freezing process actually work? Well, it's very similar to what you would do in an IVF cycle. So as I alluded to before, women actually have a group of eggs that grow up through any one cycle, and it's those group of eggs that we're actually going to recruit when we do an egg collection, whether it be for IVF purposes or egg freezing purposes. So we use the same drugs, we use the same protocols as we would use for a woman who's going through IVF. That's called controlled ovarian hyperstimulation. You start it at the end of a menstrual cycle, so day 1, day 2, day 3 of your period. It's injectable drugs. You do that for around about a 2-week period of time. You're getting blood tests and ultrasounds along the way, and we're monitoring the growth of these follicles. And when all these follicles have grown up to a nice size, ideally anything above around about 16 to 18 millimeters, we give you a trigger. And what that trigger does is it actually makes the eggs in the follicles mature. And that process takes about 36 hours. So you have a trigger, and then 2 days later, you have an egg collection. And depending on which center you go to, it's either a general anesthetic or it's done under sedation. and it's done in most cases transvaginally. We do a transvaginal egg collection or egg pickup or TVOA, depending on the clinic that you're actually with. And then those eggs are looked at, and if they are mature eggs, M2s we call them, they get frozen. If they're immature, they don't get frozen because those ones will not actually fertilize. What is the ideal number of eggs to collect? Again, it varies, but most of the research is done on an international population. And so I kind of have an ideal number of about 15 eggs. Again, if you're about early 30s, 15 eggs will get you a 70 to 80% chance of a live birth. Can we guarantee you a baby out of this process? No. Can we guarantee you a family out of this process? No. But those numbers are loosely based on international data that is available. Are you symptomatic when you go through this process? Yeah, absolutely. Because we're pushing your estrogen really high. You can get quite hormonal. You can get a little bit bloated. But it's also the actual burden of treatment itself that you've got to take into consideration. You know, the daily injections, the blood tests, the ultrasounds, all of that is a real challenge for a lot of women, particularly if you're working, and most of us are working. The fertility centres are amazing in that they try to do this around our work as much as possible, but sometimes that's really challenging to do. And particularly, and I don't know if there's anyone out there that has frozen your eggs. If you're happy to share, please do. But you know, you're trying to do this while doing a job and carrying on your normal life, and it's often not something that you actually share with a lot of people. So for some women, this is a really psychologically and sociologically challenging process to go through. So it's really important to think about where in your life you do something like this, because you're doing it by choice, and you have the opportunity to do this at a relatively peaceful time in your life. I'm hoping that helps to answer the question about the egg freezing process itself. Oh, someone then asked the question about how long can you freeze these for? How long can you freeze sperm? How long can you freeze eggs for? It depends on two things. Number one, there is the technical ability to freeze and thaw. But then number two, there's also the legal requirements wherever you are in the world or in Australia. And in Australia, every state is different. So in some locations, there's a time limit, say 10 years, for example, at which point a laboratory might turn around and actually say, do you want to continue to store these gametes? Here in Australia, again, it varies state by state. We do know that there have been cases of sperm, for example, that have been frozen for over 25 years, have been thawed out and used to fertilize eggs with equivalent fertilization and pregnancy rates. So we know that it is possible. When you deep dive into the literature around eggs, because it's much harder to freeze an egg. Why? Because it's a much bigger cell, and the process of freezing actually requires dehydration and then rehydration of these cells. And if you've got a big cell compared to a little cell like a sperm, the process of freezing an egg is just technically a lot more challenging. So if you deep dive into the literature suggests that if you are thinking about egg freezing, ideally, the sooner that you use them, the better. So if you're going to use them in, say, 3 to 4 years' time, it's probably better than leaving them for 10 years. But there's not a lot of great data on this. Certainly, there's way more data on sperm freezing. And we do know that sperm can be frozen for well over 10 years and still be very viable when you thaw it out. Somebody asked the question on that one. So if there's any more questions about egg freezing, I'm happy to answer them. Please don't hesitate to drop them in the chat box. But someone else has asked the question about unexplained infertility. And I know I've touched on this before, but unexplained infertility is when you've done all the baseline tests on a couple and you can't find a reason why they're not conceiving. You know, you've looked at tubal patency, you look to see if she ovulates, you look to see if his sperm is normal, you've done a pelvic ultrasound, you've done a whole heap of blood tests, you can't find a reason why, without gross testing, how a couple are not conceiving. So in the context of someone who has unexplained infertility, this particular person was asking, would I recommend Hycosi? So Hycosi is where you do an ultrasound and you pass, well, in most cases it's agitated saline through the tubes to see if they're patent. So there have been studies looking at tubal flushing as a therapeutic thing to help improve pregnancy rates. Hycosi itself is a diagnostic test, but you can actually do tubal flushing whilst you're doing this diagnostic test of Hycosi. And the concept of tubal flushing was published in the last couple of years in a really big multi-center study looking at, in an unexplained infertility population, does Hycosi with a product called Lepiodol, which is a poppy seed oil, does flushing the tubes actually improve pregnancy rates? And interestingly, in a young, unexplained infertility population, tubal flushing with this poppy seed has actually been found to increase pregnancy rates significantly in the 6 months after the tubal flushing. Comparing tubal flushing with just normal saline compared to nothing at all, there is also an increased pregnancy rate, but it's the flushing with this Lepiodol that's really been shown to be outstanding. Now, Lepiodol is actually, or poppy seed oil, is actually a product that's been around for decades. In fact, one of the researchers on this large scale study was actually conceived himself after his mother had tubal flushing. He presented that at one of the conferences. But I think it's important to consider the age of the couple. In this particular study, the average age of the couple was 32. That's relatively young. So I don't know that I'd consider tubal flushing as therapeutic in a couple where perhaps the woman's age is 39, because, as we said before, you've got to take into consideration the quality and the quantity of eggs as well. What's the theory behind the tubal flushing? Well, it's probably not the patency thing, because we've already proven by virtue of having unexplained infertility that the tubes are open. It's probably some sort of immunotherapy to perhaps some occult endometriosis that might be there. We don't really know the the mechanism by which the tubal flushing actually works, but it is thought to help increase pregnancy rates in that 6-month window after having had the tubal flushing itself. What I do know, however, is that it can potentially, with the Lepiodol, affect iodine absorption rates and potentially thyroid function. So this is definitely a watch this space kind of thing. And the effect on thyroid function and iodine levels can actually persist for that full 6 months. So it's really important, those parameters. But fantastic question. And yeah, for a product and a test that's been in operation for well over 40 years, to have shown this powerful data is quite interesting. And that's it, guys. That's all the questions that I had for tonight. I'm really hoping, show me some love if it has, but I'm hoping that some information on egg freezing has been helpful. Perhaps if yourself or anyone else is considering doing egg freezing to preserve their future fertility, I hope this information has been helpful. If it has, or if you can think of somebody that really would benefit from having a listen to this. Oh, actually, a question that might come back from all of this is, how do you even know your ovarian reserve? How do you know if your ovarian reserve is good, the egg count is good? We have a couple of markers that we can test. AMH, anti-Müllerian hormone, blood test. Don't do it on the pill. Or doing an ultrasound and doing an antral follicle count. These can certainly give you some forecast as to what your ovarian reserve is like. And there are nomograms that we can compare to the average woman of your age. It is not a measure of your fertility, and it's really important to say that. The biomarkers for ovarian reserve are not a measure of your fertility. They're just a measure of your reproductive potential. All right, I think I'm all talked out for a Wednesday night. Thank you so much to those of you who've joined me. If you love this information, please don't hesitate to follow. Every Wednesday night we do a Q&A session. If this talk tonight has been really valuable, share it with women and men who want to understand about the importance of fertility preservation. And I hope that you feel empowered with this information. Thanks so much for joining me. Have a good rest of your week. See you later.